Yesterday in the lecture, we'll start with the front limb. Start off with the medial scapula. So in this case, it would be a left medial scap. So you want to stand on the opposite side. Your contact hand is your inferior hand on the dorsal aspect of the scapula. And you need to follow the LOC according to the spine of the scapula, right? So you want to aim down the spine of the scapula, toward the point of the shoulder. The other important thing about this is you've got to have somebody else lift the leg up so that you're not thrusting into the ground. Because again, you will hurt yourself if you do that. You've also got to lean over. You got to be tall enough and lean over. So you go ahead and drop the leg. So you got to lean over far enough to get that proper LOC. And when you feel like you're about going to fall over, you're in about the right spot. The other thing about picking up the leg is it keeps the horse from walking away from you. Because sometimes they may want to try to walk away from you. Any questions on the medial scapula? Okay, so then the next one would be the lateral scapula, and you know we talked about with all the listings there's a reference point. The reference point is pretty much the dorsal part of the scapula. So in this case, the lateral scap means it's that way. It sort of rotates around that rib cage, right? So it's going to be that way. And the idea is to lift it up. So what you want to do in order to correct it is to lift the leg. You're going to have to cross your arms. Remember, it's important which arm goes where. The inferior arm goes on top because you're going to lift that leg up. You can see how Dr. Ennis got in close and scooted up underneath, almost underneath the horse to lift up. And again, your LOC is going to be along the spine of the scapula. Any questions on that?
Could everybody see that?
For shows in the air.
I tell you what, why don't everybody get together? That'll make it so much easier. It's too hot to be walking back. Come on down. Come down here. And then if I need to move, I can, okay? And that'll make it easier for everybody. If anybody needs to sit on a bale, go ahead and grab one. I know she does.
Watch the hand crossing. That's what I want to learn, just which hand goes over which. If you see him do it, you might try it yourself while he's doing it so you get a feel for it. It makes it a lot easier.
And kind of what you can do when you get used to doing these, you'll automatically, if you automatically pick the leg up that way, then your inferior arm has no choice but to go on top. So just get in the routine of picking it up that way, putting the arm on top, scoot in, and you're ready to go. It's almost like we said with the posterior atlases about you kind of make it like a dance. I'm not a good dancer, I'll admit it. But you know, if you do it that way, if you pick it up, scoot it in, and then just make it sort of like a dance move or a martial arts move if you prefer. Maybe that's better.
And if you align your episternal notch right with the spine of the scapula, right here, now I can thrust up just like this, okay? And it's legs.
You don't really need stabilization on that, but you may want to have somebody on the opposite side again, just if the horse wants to step away from you.
Everybody see that?
Yep.
This time? Okay. Next one, anterior.
Anterior humerus. So an anterior humerus or an anterior humeral head would be next. So you want to stand close to the shoulder. You're going to use your superior hand as your contact hand. Pick the leg up, hold it in a flex position, sort of neutral. You can see how how Dr. Ennis has his forearm parallel to the ground, hopefully. You can see that. And the thrust is going to go, since it's anterior, it's going to go anterior to posterior, or in this case, cranial to caudal.
Everybody see that?
And then the lateral humeral head would be next. So instead of coming from the front, you're going to come from the lateral aspect. And now your LOC is lateral to medial. Again, your contact point is by the greater tubercle.
You guys can't see it, move around where you can.
You guys can't see that there.
Okay?
So your LOC is going to be all lateral to medial. Yeah. Elbow traction. So next would be elbow traction. Remember, you want to place your forearm in the cubital fossa in front of the elbow. And the idea is to lift up and traction that forearm around your forearm to open that joint up.
Everybody see that?
Depending on the size of your forearm, you may have to put your arm farther or not as far in there. If you got Popeye arms, you don't have to go so far. It's elbow traction. Questions on that? So then we've got a medial, radius, and ulna, or a lateral. So if we do the medial first, remember it's medial, so your LOC is going to be
Which,
medial to lateral, so you're going to want to pull this. So if you lift the leg up, again, hold it in a flexed, sort of neutral position. And the important thing here is, can you see where Dr. Ennis' stabilization arm is? It's in between the cannon bone and the forearm. Okay? It's important that that goes there for the medial, because when you pull thrust on that medial radius, it'll stabilize. You won't be moving that whole leg around. So his segmental contact point is going to be by the radial head, and his arm is again parallel to the ground, and he's going to pull medial to lateral. If it was a lateral, he's going to hold, now stabilize behind. See how he moved the stabilization hand behind? And instead of cupping that radius, he's going to contact the outside of it with a supported thumb. Again, his arm's in the same position, and he's going to thrust in an LOC lateral to medial. You guys okay with that? Lateral and medial, radius and ulna. Okay. The anterior carpals, remember we gave you two ways to do that. That's the first way. You can see how he places the leg in between his knees. You can motion palpate, push down with your thumbs, straighten your knees out to assess motion in there, or you can just hold the leg in an extended position like that and use your thumb to motion on the individual carpal bones. The adjustment is pretty much the follow through on the motion palpation. So if you find something that's stuck, you're just going to follow through with that thrust and then go back and just motion it like you did. Okay? Any questions on anterior carpals? Hearing none. Carpal traction. This is one of Dr. Jim's favorites. Again, you want to stick your elbow in behind the carpus, and depending on the size of your forearm, again, you may have to stick it in further or not. You want to grasp the fetlock of the leg and flex it up around your forearm to open up that carpal joint.
And this is what I was talking about last night, is to assess that, the flexor tendon should come up and hit the lower part of that, so we don't have a gap in here. A lot of times we'll flex this leg and you'll feel where this is all you can get. It'll just kind of hit a bony restriction right there. And by putting your forearm in there, you're opening up all these joints. And if we go from here, a lot of times we'll get to here or even better. Okay?
Be careful.
Yeah.
It hurt them.
Yeah, there's no thrust. It's just a traction. Okay?
Accessory carpal next.
Yeah.
Okay, so don't forget the accessory carpal's in behind, and just like in the dog, there's a certain point at which it will unlock, and your job is to find that point. But just make sure that you find a spot where it unlocks and make sure it does have motion in it. There's not a specific LOC per se. You may pull, you may push, you may just wiggle it around. The idea is just to get motion back into that accessory carpal. Be aware too that they can have some veterinary issues in there that may require them to see the veterinarian. So moving down then into the fetlock, and it's fetlock, sesamoids, and pastern. You want to stand beside or behind and pick the leg up. Starting in a fetlock, you can see he's just motioning side to side, laterally, up and down, flex and extension, a little bit in rotation. Moving down, you can put your thumbs over the sesamoids and flex that fetlock to assess motion in those sesamoids, and then follow through down. Put your hand on the pastern, the other hand on the hoof, and just rotate it laterally to medial, medial to lateral, and just you're assessing lack of motion in any of those directions. If you feel a restriction, you're going to thrust in the direction to restore the motion. And he just checked all three pretty much just like that. Any questions on the front leg?
Do you want to do that on the hind foot?
If you were going to do it on the hind foot, you would do it the same way, basically.
More in the farrier stance.
Yeah.
So when you do it on the hind leg, the leg's going to be up like this.
Yeah.
Now you can assess.
Okay.
A little audible right there.
You got to come the way his vet's doing some of that.
If we got that as a listing for the exam, how do you really set up?
You probably won't. Because remember I said last night, if it's hard to give you a listing, we're probably not going to test you on it. Because what we have to say, like, right, front, medial, sesamoid, stuck, whatever.
You're not for an exam, but you are likely to see this in cases where they've had abscesses or founder or something like that, where there's been a lot of compensation, because it'll start at the foot and it'll wind up here and it'll even show up back here. It'll start at the foot, just kind of work your way, or however you want to do it, but after you've gotten everything else, go to that foot and make sure he's not. A lot of times that accessory carpal will get locked up because he's trying to get that weight off, and so it tends to kind of restrict that accessory carpal from moving like it should.
Number two, I tell people, we have two legs. We only can compensate in a limited number of ways. Obviously, these guys are on four. They can compensate in a lot more ways, but generally they kind of follow a pattern. If it's a rear end issue, they'll compensate first on the diagonal front. So, if you find a lot of stuff in the pelvis, you may want to just check that quality.
Long toe also.
Yes, yes.
So there's a lot of
Long
factors.
toe, short or low heel.
Those are pretty common. Any other questions on anything on the front? Okay. Now for the mouthfuls.
Yes.
We'll try to go quickly because it's really hard to hold the leg up. So we've got a superior internally rotated femoral head. You want to hold that leg up with your leg. You can move that leg around to assess the motion. You can see how his elbow follows a specific LOC, and it's going to be down. You don't want to down along that plane line. You don't want to thrust into the acetabulum. You don't want to jam that femoral head into the acetabulum.
And you want to keep this other hand on the point of the calcaneus, because that can keep him from taking that leg away from you. So you saw where he tried to take that leg, and I just pushed down on it a little bit, and they'll normally quit resisting, or if he continues, you pull that foot away, okay? One thing about when you do this is never, ever put your toe in the dirt like this, because now you block that toe and you blow your knee out if you pull away. Always leave that toe facing forward so that if he was to pull away, it's going to slide out, okay? Otherwise, you'll blow your knee out. So again, this is for the superior, just like that.
And then you also have an inferior externally rotated femoral head. This would be more in conjunction with an AS ilium. You can see if you guys have a hard time maybe up front seeing, but his LOC now is just coming from in the opposite direction than it was with the superior. So where the superior is coming down this way, the inferior is coming up the same way, but kind of backwards. So it's along that same plane. Remember, the superior one is the one that may be associated with a PI ilium. You can see those in conjunction. Any questions on those?
Don't you do it with the rope?
Oh, yeah, Abby.
Yeah, we need to let her show you those two.
Thanks.
Yeah.
I do too.
So I'm all about working smarter, not harder, right?
I'm trying to say.
And I'm also, I don't, especially when I got pregnant, I didn't want to be near a place where I could be injured. Plus, I'm also doing this a lot by myself, so I'm going to show you, first of all, I'm going to show you how you can do a shoulder by yourself, so the owner is not really cooperating or whatever. So what I normally do is take a rope and wrap it around whatever fetlock I need to be working on. And I'll get in position. Sometimes you have to train a horse to allow you to do this, right? Then I can pick up. So then I can hold it and able to get the line of drive that I need. Now some horses, this is just real world stuff, y'all. I mean, it's not like, sometimes it's not pretty. You know, I'm not saying that you're going to be perfect every single time. If you need two hands, sometimes you can do that. But this is predominantly just to help you get stuff done sometimes without necessarily being beautiful and pretty and perfect, right?
So you won't do that on the ABCA exam?
Right.
No.
But Dr. Abby told us to, right?
Not. Disclaimer.
We have video proof.
Disclaimer, I did not tell you to do this on the ABCA.
There is one more way to do the medial scap by yourself, okay? And again, this is not pretty either. It works better on shorter horses, okay? So it just fits your body style. But remember, all we're wanting is this leg non-weight bearing, okay? So get up here like this, grab the wrist, take the non-weight bearing and thrust down, okay?
And that was kind of what I mentioned to you guys last night too, that I just am not comfortable picking up legs like that anymore. So if I know I want to adjust in the cuts ephemeral, what I'll do is I'll just get my contact set and push till the unweight's like that, and right there I can thrust. Or I can do the same thing from here. I can push them over and unweight them, then I can thrust.
Yeah.
Is it as effective? I don't know. Seems to work for me, but
And, you know, like, it's all about leverage and trying to get the horse to help you, honestly, you know, rather than struggling so much doing it yourself. Might have to convince him a little bit. Pick up. Good way. So once you convince him, you can pull it back, you can pull it forward, you know, whatever you need to do to get the job done. And then from here, I actually have more leverage, you know, to do the adjustment. And if I can just hold him off weight, I don't necessarily have to pull him back or pull him forward, but if he's just off weighted, then I can come either direction on that femur, okay? So it's just more leverage. Oh, well. Not on the hip, on the hip. Actually get him to unweight, pick it up and adjust really kind of quickly. And that way, I personally get more leverage that way. I don't feel like, say with his shoulder, like he's got his shoulder, I have bad shoulders. And so I don't get as much leverage if I'm just using mostly shoulder muscles. I want to be able to use my pecs, and I want to be able to, say with females, I want to be able to use the biggest muscle groups I have to take advantage of that and not trash my shoulders.
Cool. And guys, if you have a handler who's comfortable, I do the same thing with the rope, but a lot of times I'll give the rope to somebody else and have them hold the leg for me so that I can be up at the femoral joint and adjust.
Technically, when we do the superior externally rotate.
Internally.
Okay, superior internally rotated, the leg goes in flexion. Okay, so you're supposed to bring it up here like, you know, toward the head. And then with the internal, externally, whatever. The other one.
At least we're not the only ones, so thank you.
It's going to be a long, y'all be ready. 3 o'clock this afternoon, y'all. We're all going to be that way. Just let you know, it's hot and
So you want to extend that leg back some when you do that, okay? So if you do the ropes, which is a great idea, have your handler bring that leg slightly into flexion when you're doing the superior and have them way back here, and take that leg slightly into extension to do the inferior, or
Got it. Yeah, that one.
yeah.
Probably
Yeah.
manually. Manually, to bring forward and go back. Superior.
Yeah.
Yeah,
You bring, take it back, bring it forward to the superior.
for the superior, we
Oh,
bring it
bring it
forward. And then inferior, we bring it back. Okay, any questions on those two?
For the superior, they're more likely to have a PI?
Yes.
Is that right?
Yes.
So if you bring the leg forward, are you making it more PI?
You need to clear the pelvis first.
Great.
Clear the pelvis
Says
first.
that in the
Yeah,
manual.
include the pelvis. Yeah, you don't worry about PI at that point.
Okay, it just links. Okay.
Yeah, you've already cleared out the PI, now you're going to assess to see if they have this.
You certainly might still be a little sore there, but
Yeah.
for the most part, once you,
And you're not going to flex that leg too far forward,
Just a little bit.
just a little bit, yeah.
Okay.
If you have if you don't feel right about that PI, definitely fix it first. But if you need to adjust the femur, go ahead. You can always go back and recheck for the PI, right?
Yeah.
And if for some reason it was a doctor-induced PI, you can always go back and adjust it again, right?
Okay, cool.
so, so the reason we're trying to move the leg forward or backward, remember that, look at the anatomy on that horse with Dr. Harris yesterday. That greater trochanter is pretty much straight up and down, right? So if you're coming from a northern angle, you need to get a purchase on that. And the easiest way to get a purchase for that directionality is to bring the leg a little bit forward. It doesn't have to be much, just enough to change that femur angle enough so you can get better purchase. Same with the inferior. You just bring the leg back just a little bit to change that femur angle, just a few inches, it's not much. That way you can get better purchase.
Remember that femoral head is fixated inside the acetabulum. It's not outside, okay? So there's not a lot of room to begin with. So you don't have to do a lot of leg movement, just enough to encourage that. If it's a superior, just enough to put a little tension on it where it'll pull it down when you adjust it. Same thing with the inferior. If it's rotated down, we extend it, we're kind of helping bring that femoral head back up into the normal area.
Did you guys notice too that when Dr. Ennis was working with that rear leg, how he kept it pretty much under the horse? We were talking this morning about some people that are not doctors, that are lay people that are adjusting horses. They're trying to adjust the pelvis, but they're using the rear leg to try to adjust the pelvis. And what they'll do is pick that leg up, pull it out, and just try to lift them up in the air. Well, horses' legs weren't made to come away from the midline. They're made to work in the midline, right? If you try to pull that leg out from the midline and do that, what do you risk? Tearing the round ligament. Remember, the round ligament holds that femur head into the acetabulum. So if you pull those legs out, you can tear that round ligament. And if you tear that round ligament, that horse is through. There's no fixing it. So
Also the psoas and those muscles are,
stress and strain them.
And clock and stifle too, so you're hyperflexing in.
So also on this femur, it's kind of a long lever move.
Yeah.
If you think about the anatomy, the joint that you're affecting is in here, and you're actually out here on the greater trochanter doing this. So it doesn't, although it's a huge area with lots of thick muscle, it actually doesn't require, if you can get the anatomy right and get your leverage right, you don't require a lot of force.
You guys ask us questions sometimes about how we do stuff, and we do it so often that sometimes we forget what we do. It's like, well, how do you do this? I don't know. I have to go think about it. How to do it. And I think somebody asked me yesterday about, do I see a lot of those? And I said, no, and I take it back. I do.